Hello, thank you for joining today's webinar. My name is Hope Newport. I'm the Family Services Manager at the International FOP Association, and you are at the Insurance Navigation and Enrollment Eligibility webinar that we are doing with the Patient Advocate Foundation. So I'm going to introduce our speaker in just a minute, but before I get started with that, I wanted to say that this webinar is part of our Advocacy Series. So the Advocacy Series is an educational program here at the IFOPA that really aims to increase the confidence and the skills that our individuals with FOP and families have in navigating a very variety of different aspects of life. But this year, we're focusing specifically on financial planning and government benefits. So we know that a lot of our families spend time, energy, and unfortunately a lot of time with headaches trying to navigate this aspect of life to access benefits and financial tools that help ease the financial burden of living with FOP. So this is something that is a big topic to tackle, and I do want to say this topic of the advocacy series is only open or really relevant for our families here in the US. So you are going to see us going a little bit deeper in some of our resources into US specific programs or tools, but it's one that we have kind of, had in the back of our minds for a while, but with the recent approval of the first drug to treat FOP, we feel like it's a really important time for our families to become more well-versed and comfortable in this area. I am excited to introduce you all to our speaker for today. So Courtney Jones is joining us from the Patient Advocate Foundation, as I mentioned, and Courtney joined PAF in 2004 with multiple years of social work experience. She has grown with the foundation and worked in many different levels of the organization, from case manager and their case management program, which she's going to tell you more about, to quality insurance, and finally senior director of their case management services. So through her tenure, Courtney has made it a mission to see that every patient has adequate access to care, as well as to provide help to patients in managing their diagnosis, treatment, and survivorship. In her current role as Senior Director of Case Management, she provides oversight on daily operations for the case management division and partner support services. So I'm going to stop my screen share now and hand it over to you, Courtney. Thank you so much for joining us today.
Thank you for having me. This is a good topic to start discussions on. It will be a lot of information, so I tried to break it down as easy as I could. But it's good to know that it's being recorded and everybody can go back and kind of dive a little bit deeper into some of the information on the slides. I'm going to talk a little bit about just giving you the understanding of who we are at Patient Advocate Foundation and what we do for patients. Then I'm going to dive really into the topic of what is health insurance, what are the options available, and then looking at Medicare and Medicaid, marketplace insurance, and then where you can find some patient education materials and resources that we house at our organization's website. So, here at Patient Advocate Foundation, we are a national nonprofit organization that provides case management services and some financial support to patients with chronic, life threatening, debilitating illnesses. We help with a myriad of different issues, which I'll get into a little bit later. But we, again, as mentioned, help throughout the United States. We are not diagnosis specific, and we do not have any income guidelines, any definitions or guidelines that you have to be insured or uninsured. We just want to make sure that all patients have access to care and that they're able to utilize their insurance coverage and maximize the benefits that they should be able to currently access. We have very many different areas under our umbrella Patient Advocate Foundation, one being case management, which I oversee and I'll be really talking about. We do have a copay relief program, which is what I was mentioning in our financial support, that helps with some copays for health insurance premiums and medications. It is diagnosis specific for our copay relief program, so you would have to check our website to determine if there is funding available and applications open for the diagnosis. The same with our financial assistance services. Those are small financial grants that offers support for general cost of living concerns, transportation, childcare needs while trying to access treatment. Those are diagnosis specific as well and do have some eligibility criteria around them. We have our patient education and support. So that is, I'm going to speak about too, where we have a wealth of information on webinars that we host and that really dive deep into insurance coverage. It dives into insurance appeals, Medicare, disability, as well as some other areas. And then that houses our robust listing of financial resources, which I'll get into in a little bit. We deal with a lot of health equity and community engagement, making sure that we're in the community and speaking about the patient impact, which is our next area right here, because we see patients and get their impact stories in real time. So we're facing and assisting patients at the time of their concern, so we can see what trends are coming and what we are seeing in certain patient populations. We host some special events, and then of course, all the data that we collect helps us support some research, patient experience, and evaluation. That kind of goes back to what I was saying with the patient impact and the stories that they provide. So, talking about case management and how we help. So, this is just some numbers so you can see that we in 2022 we've assisted over 18,000 cases, and have an average of 23 contacts per case. Which, to explain that, that is speaking to patients, making conference calls for patients, connecting them with insurance, helping appeal insurance denials. So it's taking on average 23 contacts to resolve a case, which shows you the complexity of issues that patients are presenting and that we're helping them work through. I just wanted to lay out some of our top diagnoses and areas of support as well. So you can see that we help with a myriad of issues, not just insurance related, but even those that are uninsured or are having access to care issues. And then, of course, we can see how patients, excuse me, find case management services. We are referred by many different organizations, such as you all's, some in the healthcare field, nurses, social workers, and then some friends, family, and other organizations. So we do have some services and eligibility criteria. While I said you do not have to have any insurance status, we don't look at income, we do require that a patient to obtain case management services be a U.S. citizen or permanent resident of the U.S. There's a lot of different areas of support and insurance areas outside the United States. So we are only focused within the US. And then we ask that you have to be receiving treatment at a facility within the United States or one of its territories and have been in, or excuse me, are currently in active treatment, have been in treatment in the past 6 months, or will be starting treatment in the next 60 days. As we know, sometimes the access issues prevent those from starting treatment. So we want to make sure that we can overcome those barriers to be able to help you access treatment. So these are the areas that we focus on, and there's three main buckets. One is reducing the financial burden. So that is what I was mentioning about locating resources and making sure that patients understand some financial assistance programs that are out there and making the connection to those programs. Providing educational and emotional support resources to include online support groups, some wellness resources, and educating on employment protections such as ADA or FMLA rules and regulations, and making sure how you can go about those workplace benefits and accessing those. The other section is enrollment into appropriate insurance, charity, and social programs, and that's kind of what I'm really going to be speaking about today. Is understanding eligibility and enrollment into products such as Medicare, Medicaid, accessing Social Security disability, ACA products, which you've also heard referenced as marketplace insurance, charity care, and negotiation or discounts for medical care, and helping patients apply for those, as well as, again, unemployment benefits, short term disability, long term disability. The other is providing insurance navigation. So that is once you have insurance, how do you utilize it? Making sure that we understand how to access pre-authorizations, any clinical appeals and denials that may come. There's coding and billing issues. Patients may face out-of-network concerns or want a second opinion. So understanding how to access those and facilitate any insurance appeals for denied treatment and medications. So that's kind of PAF in a nutshell of what we assist with on a daily basis. So now what I really wanted to focus on is how health insurance, what does it mean? So breaking down what I call the jargon that you kind of hear with health insurance and what those mean and how to access different areas of health insurance. So first and more important is understanding what is health insurance. It covers medical expenses for illnesses, injuries, and health conditions. It's a way of paying for medical bills and healthcare costs. And there is no penalty for using health benefits. So I just want to make sure that's important for everyone to know. It's there for you to utilize, and you're not going to be penalized for you using a health insurance coverage that you have. And it promotes health by allowing an individual to seek care when needed. So what are your options for health insurance coverage? Well, there's options from your state or your federal government referenced as Medicare and Medicaid. Now, it's important to state that Medicaid is called something different in each state. So, for example, in California, it's referenced as Medi-Cal. In Maine, it's referenced as Maine Care. So, you may have to know and understand the terms that are being used, but that does mean Medicaid. There's also health insurance options that you can gain from your employer, from group coverage plans at your job or your spouse or partner's job. And then for young adults, they could be accessing a group health plan through their parents' insurance up until the age of 26. From the individual market, we now have the Affordable Care Act, ACA, some people reference it in marketplaces, another term that's often used, or health insurance exchange for your state. You can then go directly to a private insurance company, insurance broker, or agent. I will say that those come with some higher premiums, some exclusions that the Affordable Care Act health insurance have more protections from than directly from a private insurance company or an online insurance seller. There's also military or VA benefits that are available. There's insurance that you can sometimes hear about buying through an association or membership organization. So sometimes through there's unions, there's banks or credit unions that sometimes offer some insurance coverage. And then if you are leaving your employer, you can now access that coverage through Cobra. And we can kind of talk about that in a little bit as well. Now, when looking at insurance, plan structure matters. There's very different types of insurance coverage that all can provide different levels of support and coverage availability. So you'll hear HMO, which will require referrals. So you'll have a primary care physician with an HMO that will request that you have referrals if you go to any other provider, such as a specialist or a hospital, so that all your care is directed through that primary care physician. So it's a more restricted coverage type. You have PPO, which gives you the broader area of coverage that allows you to go where you want to go as long as they accept your insurance. That gives you the availability to not have to direct all your care through a primary care physician, and you can go to specialists, hospitals, as long as they are within your network. There's high deductible health plans or HDHPs that provide different HMO or PPO coverage, but they come with the higher out of pocket deductible cost. So in those scenarios, you typically pay a smaller monthly premium amount, but you're going to come out of pocket more at the beginning with your deductible before the insurance starts to pay on any of your claims. And we'll kind of talk about some of this jargon or the insurance talk that I'm speaking about in my next slide. There's indemnity plans that are very restricted and have limited coverage. And again, are similar to an HMO and drive you through a primary care physician. And then there's catastrophic coverage. This is even more narrowed, and as it doesn't cover the broad range of disease maintenance or treatment. It's more just like what it sounds like, a catastrophic illness. So it will just help in an accident situation or something catastrophic that will be able to be covered and then moved on from. So when I was speaking about the insurance terms to know, there's several different terms you're going to hear when trying to discuss insurance coverage or reviewing options that are available to you. One is premium. That is the amount that you must pay every month for your health insurance coverage. It's just what you pay to be able to have that coverage at all. Your out-of-pocket costs will include the amount you pay on covered health insurance. So how much collectively you will pay or are required to pay in your covered health insurances out of pocket. Then when you talk about out of pocket, you have what's called out of pocket maximums. So that's the most that you will be required to pay during a policy period or year before your plan starts to pay at 100%. These are usually very high limits, um, somewhere in the tens, $15,000. So for your policy period or your annual year, what you would have to come out of pocket, and then your insurance pays at 100% and will not have any other cost share to you. That's different than deductible. The deductible is the amount that you must first pay before your plan begins to pay anything. So you may come in with a $5,000 deductible, so you will have to come out of pocket $5,000 before your insurance starts to have any coverage available to you at all, before your insurance starts to pay on any of your claims. Typically, after a deductible, then you start to incur your co-payments or your co-insurance, which are the next two terms. A copayment is a fixed amount. So that's a standard dollar amount. It is $50, $25, $100 that you will pay per visit. So those are usually doctor visits or your initial hospital day that you're admitted. They will say, your doctor copay is $30 for your primary care physician, 50 for a specialist. Those are just for the visits. Then you come into what's called co-insurance. These are percentages or your cost of share that you will be expected to pay as a percent of the allowed amount. So again, the copayment was the fixed amount. The co-insurance is the percentage. So that's where you'll get your insurance pays 80%, you pay 20%. So then you have your doctor copayment for $30, and you have some lab work or infusions that then you pay a co-insurance of. So these are where you start to get more than just a copayment and more bills coming in. You will have your doctor bill, you may have your lab bill, your hospital bill, and they will all have different coverages and different amounts based on your insurance contract. A formulary is a list of approved drugs that's covered by your prescription drug program. So sometimes these are carved out, and you may have a coverage underneath another entity of your insurance that covers your drug costs. But you need to understand what is on your formulary, which is what is your covered drug. And there's different tiers within your formulary that will come with different costs. Then what is a covered benefit? It is a healthcare item or service that is covered under a health insurance. Then you have non-covered benefits, also known as exclusions, that are laid out on your insurance coverage that will explain what your insurance does not cover or does not pay for. When I mentioned formulary, then we get into prescription tiers. So your medications are assigned a category based on variable areas like of drug usage, clinical effectiveness, and these tiers come with different costs. So typically your tiers 1 through 4, some can have a 5th tier, and as you go up, the costs increase as to what your out-of-pocket copayment or coinsurance would be. And then again, the specialty drug tiers, that's usually your 4s or 5s. are the highest drug categories, and that will, of course, make you have a higher copayment or coinsurance amount. And usually have to go through a specialty pharmacy, and that's in infusion centers. And sometimes these drugs are delivered at a hospital or a medical setting, or they have to come through a specialty mail order pharmacy. That's not usually your what I call your brick and mortar in pharmacy that you can just go to and pick up like your local CVS, Walgreens, and such. So that's kind of some of your insurance terminology that if you're just even looking at your summary of benefits, that you may start to see and hopefully understand a little bit better. But some important insurance documents that it's always important to know to be able to access and to understand is your summary of benefits. That's usually a 2 to 3 page, what I call summary or snippet of your plan. It's the down and dirty of what is covered and how the plan works. It'll kind of lay out a lot of different information to say, this is your in-network copay. This is your out-of-network copay. This is your hospitalization. This is what you pay for an ER visit. This is what you pay for physical therapy. It really just kind of line items what your plan covers. Your certificate of coverage is also what I refer to as your plan language, but that provides the very detailed information on what is covered and not covered. It is 100 and plus page document, so you will definitely be able to tell the difference between a summary of benefits, which is a quick snippet, versus your certificate of coverage or plan language, and know which one you're looking at. Your certificate of coverage is usually what our case managers will always reference and really dig into because that will alert us to what is covered, what blatantly states is excluded, and when it shows your coverage, it will provide in great detail what information needs to be met medically for that said treatment, surgery, infusion, etc., to be covered. So that's where we really dive into being able to understand what medically you need to provide to the insurance to make sure that your coverage is approved. And if it's not approved and denied, this really tells us what we need to show the insurance company on appeal to get that appeal overturned and approved. Your explanation of benefits, also referenced as EOBs, is the document that lays out how the claim was paid. So, what was billed to the insurance company, what the insurance company paid, what your portion of the cost will be, and how that is divided out. So, that's your line item from what your physician's office, your hospital billed to your insurance company in each payment that was made in the breakdown of what is your deductible, what is your copay, what is your insurance, what was covered, what was denied. So that is something that you will receive upon every claim submittal to an insurance company for your cost of medical visits, pharmacy, and that will really help you understand how your insurance broke down that cost and paid it out based on your certificate of coverage, which is how your insurance is structured. Insurance is very different. It can be different from one person down the street to the next, depending upon many different areas. The product you have, how you have your insurance, whether it's, your plan at your employer, and what level of coverage that you have. So it's very important that you understand what you're signing up for or what you're purchasing in insurance coverage to make sure that the plan works for what your needs are. You can get a lot of that information from your summary of benefits, but it's also important to understand that certificate of coverage with a diagnosis to really know what's covered and not covered.
Courtney, I had a quick question I wanted to ask before you moved on,
Certainly.
especially because we did have a drug that was just approved. How often do insurance companies update these documents? And how will people know if there's a newer version that maybe they got their original version when they signed up, but how often should people look for updated versions of these?
Great question. Formularies can change in the midst of a plan year. So that is important as drug coverage comes into play to make sure that you're routinely checking on that. The other area is what physicians or hospitals could be in network or out of network. Doctors will change what plans they accept, and it's always well, it's usually, I guess I should say, but most of the time always on the onus of the covered individual to know to ask and to check on that. I always encourage every patient, every individual to log in and sign up for your insurance portal. That is a quick a way to go in and always check your coverage. You can typically download your certificate of coverage, that big long document, but you can see at quick glance in your portals the formularies, your current formulary. You can really dig in to see when the last time that that medication was reviewed. And if something changes a tiered level, so you can have a tier one, a tier two. So some of this is usually in flux throughout your coverage year. So it's always good to try to make sure you stay on top of that. But that
And
was a
the
really good
signing into
question.
your insurance portal is a great first step because sometimes this feels so big and like so much information. So just creating that login or getting signed into your portal is a great first advocacy step. Thanks.
Yes, very much so. That will give you, like I said, right at your fingertips, a lot of the information that you're wanting to know and being able to search and dig into. So what I was mentioning earlier is physician offices, hospitals, and such going in and out of network. So what does in or out of network even mean? In network refers to the healthcare provider or medical facility that has a contract with your health insurance plan. So they've contracted with your health insurance that says we will accept your covered individuals and we already have a pre-negotiated rate. So your insurance company and your provider has already agreed on what the coverage is and what they will accept as an agreed upon amount um, as coverage for whatever said claim that is. And so, because of that relationship, you would pay a lower cost sharing when you receive services from an in network doctor because there are already pre negotiated rates. You get some discounts. Now, if you go out of network, and if anybody's ever looked at their summary of benefits or their 2 to 3 page snapshot, you will see there's usually two columns. Your first column usually says in network, your second column usually says out of network, and they're varied in what their coverage is. For instance, in-network coinsurance can be 80% the insurance pays in network, 20% you pay in network. If you go out of network, then you may pay 40% and your insurance now only pays 60. So you pay a larger cost share to go out of network. An out of network provider is one that doesn't have a contract with your health insurance plan. And so there is no negotiated costs. So your insurance will pay what they find as a reasonable rate based on previous in network coverage. And then, depending upon the services that you received, you could then have to be responsible for the remainder of that bill because there is no contractual obligation for the medical provider to discount any of the other services that were not covered by your insurance. So it's usually a lot more costly to pay out of network. Um, there are ways to get out of network claims paid at in network rate. They can be done through appeals, but that usually means a lot of medical documentation to show and support why you medically need to go out of network and cannot obtain that same coverage at an in-network facility. Now, with certain rare diseases or specialty required treatment, you may face this scenario with needing to go out of network because you cannot find that specialist within your network that would be able to support the medical care that you need. So there is support in certain rare diseases and treatment related issues that you can go out of network and get it covered at an in-network rate. So when I talked about a pre-authorization, that is a lot of higher cost medical care, surgeries, certain infusions, therapies, typically require pre-authorization. So for medical, again, that's inpatient admissions, some home therapy, radiology services, surgical procedures, or durable medical equipment, also known as DME. Then you've got the medications, which are brand name medications that are usually costly. The expensive, again, I talk about, and those that are distributed exclusively through a designated specialty pharmacy. So I spoke about specialty pharmacy tiers earlier, that usually require mail order specialty or through an infusion center or some hospital care. They are required for pre-authorization before you can receive that said surgery, medication, and such. And there is a time frame, typically 48 to 72 hours that they have to give a turnaround time to give you an answer to your pre-authorization. It's not common that you ask for an after pre-authorization, but that can come in emergency needs, such as, ER visits and they have to rush you into surgery. They obviously don't have the time to do a pre-authorization, so those can come after said medical emergency. So when you get the pre-authorization, if it is denied, there are levels of appeals or types of appeals that can happen. So again, I say pre or prior authorization. So your coverage denial can come prior to the care being provided, or your decision's no later than 30 days after your care was received. Then you can do a retrospective appeal. That means your denial of coverage is after the care was provided, and then they have to give you a decision on your appeal no later than 60 days after the care was received. So these are typically the retrospective, like again, are the emergency situations, and then the care was already done, and now the claim is denied, and you're having to appeal. Your pre or prior authorization usually comes prior to your care being received. The claim was, or your pre authorization was denied, so you couldn't obtain said medication or treatment, and now we need to appeal it to get it overturned so that you can access it. There's also the ability to ask for an expedited insurance appeal decision. So that means that you have to show medically why the treatment or your inpatient stay may have adverse effects on your life, or can result in death. And then they have to provide you a decision within 24 hours. So those are the immediate needs for an appeal. And they have, like I said, the 24 hours to review and give you your determination. Now, with insurance appeals, there's multiple levels of appeal. So you have your first level that's usually completed internally by your insuring entity, so your insurance company. It can be done telephonically, you can request it. Portals now also, we're starting to see where you can appeal your denial through your portal or by filling out a form and mailing or faxing. If your first level appeal is denied, you now can go into your second level appeal. That's usually completed by a provider of the same specialty, and can be done again telephonically or by portal or mail. If your second level is denied, you have a third level appeal, and that's your external appeal. So that now is a third party entity that is neutral and is outside your insurance company that will review all the medical information submitted and make an external decision that is binding, and the insurance has to follow that said decision. So it's unfortunate if cases do get to the third level appeal, but a lot of times they are successful at that, being that they are external. And we've had a lot of medical information provided that an outside entity can review. So that is insurance in general and the commercial world is what I'm calling. So I wanted to talk about Medicare and Medicaid because those are other avenues of support to get coverage. And I wanted to explain the difference between the two because they do sound very similar and are often misunderstood in their coverage and how to access. So Medicare, there's three parts, A, B, and D. And Medicare A is hospital insurance, and that's exactly what it just covers. It covers hospital stays or skilled nursing facilities and hospice. It can be premium free if you or your spouse have paid the Medicare taxes and have worked for a certain amount of time and paid into Social Security and Medicare. Part B is your general medical insurance. So that covers your outpatient physician coverage, tests, durable medical equipment, preventative services, excuse me, and some outpatient prescription drugs may fall under your Part B. Those are usually infusions. And this monthly Part B premium is what you pay premium wise. And when I say it's based off your Maggie, it's your income. But most people will pay the standard monthly Part B premium, and that changes every year. So it can be different and averages about 180 to 190 a month. Your Part D is your prescription coverage, D for drugs. Those are specific Medicare approved plans that you can choose to enroll in for prescription coverage. And each plan varies in the drugs that are covered and the costs associated with them. So if you are on Medicare or getting ready to go on to Medicare, you would have a card that is your A and B coverage, and then you have to select a prescription coverage. So that is outside in a standalone coverage benefit from your A and your B. So who is eligible for Medicare? There's typically two areas that are covered. The easy way to break it out is if you're 65 or older, or if you've been on disability for 2 years or more. So I kind of put a little bit more information in here, but those are the two most common ways. So if you're 65 or older, you have to be a U.S. citizen or permanent legal resident in the U.S. for at least 5 years. One way is receiving Social Security railroad benefits, and typically that comes when you're 65. Some can get earlier. At 62, you can start receiving Social Security retirement, but you would not be eligible for Medicare until 65. The other one I mentioned is disability. So receiving Social Security disability benefits for at least 24 months. So yes, you have to be on disability for 2 years before you would even get the Medicare coverage. There's only two diagnoses right now that give you immediate Medicare without the 24 months. That is ALS or Lou Gehrig's disease, or you have permanent kidney failure, which is end-stage renal disease, and it requires dialysis. So if you are eligible for and need to apply for Medicare, you can do that through the Social Security government website or go to your local Social Security office. And they can help you access coverage and enroll into Medicare and make sure that you choose your Part D drug plan. There's also some Medigap and Medicare Advantage plan options. I did not get into that information too much now, but I can explain where you can find that in some of our educational materials. So then that was Medicare. And now what is Medicaid? That is a federal and state program that helps with medical costs for individuals with limited income and resources. Now, Medicare is federal, so that covers the same throughout every state. Now, Medicaid, the rules and eligibility will differ between states. And remember, I had said in a previous slide that even states can call it something different, where California would call it Medi-Cal, Maine called it MaineCare. So we have to always look at the different varied eligibility criteria under Medicaid and know who would be covered or who would not be covered. So what is that eligibility? Generally, to qualify for Medicaid, you have to reside in that state. So you have to be a resident. You have to belong to an eligibility group. I know that sounds odd, but it means a certain criteria of people. So are you a child under 18? That's an eligibility group. An adult with low income that have children in the home, an aged individual over 65, a disabled individual, again, on Social Security disability. So these are eligibility groups that you have to meet. And some states have broadened their group that allow a larger pool of individuals to qualify. And I'll kind of talk about that in another slide. And then, of course, you have to meet certain financial and resource requirements. So when I said I would kind of talk about Medicaid and those outside of some eligibility criteria and how states are a little different, some states have expanded, and what you may have heard Medicaid expansion. You may live in a state that expanded Medicaid and have heard this throughout the news. So states could have a decision on whether or not they wanted to expand their coverage. So this is the latest slide that I could find on which states have expanded versus which ones have not. The ones that have expanded are in blue, the ones that have not are in that orangish yellow color. And the ones that have expanded means that you can qualify just based on your income alone. You don't have to really meet one of those eligibility groups. They just basically have said if your household income is below 133% of the federal poverty level, you would qualify. Some states have even gone above and beyond that and increased that 133 to 150, 170. So again, states could have some varying eligibility criteria. So I can't get specific in states because you would have to look at your state alone to determine what that eligibility criteria is. So the other avenue is what I call marketplace insurance, or Affordable Care Act is what brought this marketplace exchange to fruition. So it's a great option for those who can't or don't get insurance through an employer, for part-time workers and that may not have insurance options available through their employer, gig workers or independent contractors, those who turn 26 and can no longer be on their parents' insurance, or those who don't qualify for Medicaid but still need some financial help to afford insurance. So when we look at Marketplace, it is a website that you can go to under healthcare.gov, and that allows you to look at your independent state. Each state is a little bit different in their coverage. It's different in their insurance options that they allow. So again, I can't just say what they offer because it is varied by state in their coverage. It also varies by level. So there's bronze, silver, gold level insurance that all provide different level of coverage. That's all that means. It just means that some may have lower premiums, some may have lower deductibles, or they may have higher premiums and higher deductibles. They just put them into, silver, bronze, gold buckets. Now, with Marketplace, there is some financial assistance available. They're called premium tax credits. So when you're looking at Marketplace insurance, you can also look at what your anticipated household annual income is based on your taxes, and that could qualify you for premium tax credit. That can then lower the cost of your monthly premiums in the plans of that metal level, the silver and the gold. So you're eligible for these premium tax credits if your household income is between 100% and 400% of the federal poverty level. So that could be varied depending on your income as to how much tax credit you get and how much that lowers your premium or your coverage deductibles and out-of-pocket costs. So just at a quick glance, I know I've talked a lot about insurance. So tips for choosing the plan is cost. Make sure you understand what the plan will cost you, including your premiums, deductibles, and your out-of-pocket. So you know what your coverage means and what your insurance will afford you. Typically, the rule of thumb is the lower insurance premiums you pay monthly, the higher out-of-pocket costs you will have to incur at the beginning, higher deductibles. The more premium you pay up front a month, the lower the deductible is. But just make sure you understand the cost that you're getting into. Your coverage, make sure the plan covers what you need. Every individual is very unique in what services they need. So what doctors you go to, what medications you are on. So always make sure in every year at open enrollment, this is something that you should look at because plans change, your health changes. So you would need to know the cost, the coverage, and again, the providers. Make sure your providers are within network. Check your prescription formulary to make sure that your current prescriptions are covered and the time. Make sure that you take the time when choosing your plan. I said your Medicare plan, but it could be any plan, and understanding what plans are available to you. Again, on annual enrollment, it's a good opportunity to sit down and access all this, look at it all, and understand what that current situation looks like and what coverage would be best for you at that time. Now, the last bit of information I'll cover quickly is our patient education and resources. So, at Patient Advocate Foundation, which our website is patientadvocate.org, we have, as I was mentioning, a very robust educational resource library, and it has a full catalog of educational content. So, we have a lot of webinars that break down the insurance appeal process, Social Security disability, insurance coverage. It breaks it down into small modules that makes it a little bit easier to digest. But we also have a great range of publications to read, what I call snippets or one pagers that gives tip sheets in very different topics. So that is a good, robust area of information. You can just type in a subject and it brings up so much information that you can then read about and dive a little bit deeper into. And then our National Financial Resource Directory is also on our education page. That is a search tool where we are in real time keeping up with financial and other resources that are available to patients. So you could just go in, put in your age range, a diagnosis category, the state that you live in an area of support or need that you're looking for, transportation, co-pays, and then hit search, and it brings a large list of resources that are available for you to browse, for you to print, email to yourself, and that links you with the website to that organization, the phone number, and a snippet of their eligibility criteria or what assistance they provide. So it's a good tool to be able to review and get a list of resources that are relevant and customized to your unique situation. And we've had many searches over the years and have a good amount of resources in there. And just so you know, that is the same tools that our case managers use internally. It is published externally for anyone to use, but that is what we use internally in case management as a navigating tool to find these resources and to make those connections for patients as well. So we didn't want to keep it as a secret for ourselves internally in case management, and are happy to be able to share that and a lot of our knowledge and information through our education tools. But I do appreciate the time that you have devoted to understanding insurance. As mentioned before, it is a very complex situation, to dive into, and there's a lot of good information. I just tried to give you the baseline of understanding insurance and some tools to be able to navigate and know what you're looking at and what that kind of means for you. But thank you very much for allowing me the opportunity today.
Oh, thank you, Courtney. That was an incredible presentation. It is a lot of information. So for those of you who are watching, if you feel overwhelmed, you're not alone. Even I feel overwhelmed. I'm sure Courtney still feels overwhelmed after all those years at times. But the goal of the advocacy series and what I hope you'll all take away from this is that any step you can take in better understanding the process, things like the sort of glossary of terms or your health insurance literacy, just your ability to comprehend the jargon that's sort of thrown around in conversations or that you see in your documents from your insurance company. Even if you're just able to better understand a little bit of that, that's a great first step. Courtney mentioned the portal as a tool to take, and then we get questions from families all the time about navigating Medicaid, insurance, all of those different things in the IFOPA. We're a small, we like to think mighty organization, but rather than recreating the wheel of a directory, we're so fortunate and grateful to have organizations like the Patient Advocate Foundation that have spent their time to put together the financial resource directory and have been so generous to make it public so that all of our families can access it as well. So I hope you all will see that as a tool to go back to in the future as well. And I did want to leave time for questions. I haven't had any come in through the Q&A that I have seen. I do know people submitted a few questions ahead of time, so thank you for doing that. We had a question about ABLE accounts, and I wanted to let you know that we've actually done a webinar with a member or a representative from the ABLE accounts program. So I will link to that webinar in the follow-up email that gets sent out to everyone with the recording of today. And I would encourage you to go back and watch that webinar. It is completely devoted just to ABLE accounts. So a great way to dive deeper into that. We also had a question that was from a parent of an adult with FOP, and they were kind of coming at more of these financial lens of wanting to know if there's anything they should be aware of or consider in giving or willing money to their child with FOP. So Courtney, I know you and I had talked about that a little bit, and you're not a financial financial resource expert, but in terms of impacting insurance, is there anything you'd say in regards to that?
Yeah, the only thing for giving or willing any income to a young adult or child would be the impact that it could have on Medicaid that have income and resource criteria, could be counted as a resource or an in-kind income. Um, and then go into the eligibility criteria as well as marketplace if there's looking at premium tax credits, that takes even those willed income to that takes into account that even though it's outside of employment or a disability payment, it is still counted as an income.
And we did do another webinar actually with a special needs financial planner. Her name is Debbie Neiman, and that webinar was recorded, and she talks a lot more in depth about ABLE accounts or special needs trust, tools like that that you can use to help navigate some of the financial, I guess, traps or crossroads that are in place that kind of sometimes can prevent people from being eligible for things like Medicaid or staying eligible for things like Medicaid. So let's see, there was another question that came in. What are the benefits of having Medicare Part C versus Part A, B, and D?
Great question. I did not dive too deep into C, so I know that you know your information to know that it was even called Part C. But it just basically includes all of your A, B, D coverage altogether. So you don't have your separate A and B and then your prescription coverage. It wraps it all together in a package. And some of those offer additional benefits. Some will offer some dental coverage that your typical A and B does not. It also offers some nutritional support that your A and B does not as well. However, the only other caveat to a C coverage or also Medicare Advantage plans is that they come at an additional premium cost. So you would have the premium of your A and B coverage still, and then you would have the premium cost of your C coverage. So it is more, but it does provide you a little bit more benefit as well that your general A and B does not. And again, when you're looking at your C coverage or your Medicare Advantage, they are varied in their coverage and what they provide in their level of support. That is also associated with premiums. So those premiums can vary and the coverage can vary. So I would always say to make sure that you look at that, but they do offer a broader range of support that Medicare A and B typically does not.
Great, thank you, Courtney. And if anyone else has questions, please do feel free to drop those in, and we have a few more minutes here to get those answered. But In closing, I did want to let people know that this topic was really, Courtney's presentation was really relevant to obviously prescription drug, but also we saw durable medical equipment. We know a lot of our community uses wheelchairs, beds that fall under that category, and then also seeing specialists. So whether it's a respiratory therapist or a neurologist, or, there's a lot of different specialists that our families have to work with. And so we hope that you'll come back and consider how your insurance coverage or selection impacts those various aspects of life with FOP. The next resource in the advocacy series in this topic is going to be a podcast that I'll be doing with the leadership from the Soft Bone, so another rare bone disease group that has had a drug approved. They are going to be talking with me in an interview that will be shared with all of you as a podcast about how their community sort of navigated that time after drug approval, navigating insurance, denials, appeals. As we heard Courtney mention, that's not an uncommon part of accessing prescription drug. So that is a resource for you all to look forward to. We hope to have that out at the end of the month or early next month. And then the last part of the advocacy series program is a community panel where you all get to hear the insight from different members of the community who have navigated different challenges or struggles with their insurance, and just be sharing sort of the tips they used, the resources or the tools that they found that made those journeys easier for them. So 2 really wonderful resources to come in the next few months, and please keep an eye out for that podcast that'll be up next, and then the panel, which will be in October. And I am going to go ahead and drop the link in the chat for the survey. So if you're still on, thank you so much for staying through the full webinar. Please do click that link in the chat to complete the survey for today's webinar. We always love hearing your feedback and hope to be able to incorporate it into programs in the future. But that is all for me. I would end with a great big thank you again to Courtney. I know you have very full days in the office at the Patient Advocate Foundation. And so thank you for taking time out of your evening at home to make it convenient for our families to be able to join in and listen. And you're just an incredible wealth of information about this topic. So I want to thank you for joining us here today and for being a part of such an incredible organization. So I will be sending out the link to this recording along with the link to the ABLE accounts, the special needs financial planning webinars that we've done, and then of course to the Patient Advocate Foundation website where you can explore more of the resources that Courtney shared with us today.
Thank you all.
So thank you. Oh, Steve, sorry, did you have something you wanted to add? Here, I'll unmute you for a second if you want to. We have just 1 more minute left if you wanted to share your.
Yeah, I just wanted to add in real quick for those folks, particularly on Medicaid. Medicaid is, as the presenter shared, a state-by-state program, but you can use Medicaid in other states in an emergency situation or with prior approval. Your case manager can help you get that prior approval for other circumstances. Many private insurance these days will have nationwide coverage networks. You can use your provider directory to identify where you can find coverage. If anyone's got any questions, do feel free to reach out to me on support for FOP. Happy to help navigate.
Thank you, Steve. What a great way to end with some input from the community as well. A great representation of how supportive you all, the FOP community, is of one another. So with that, I hope everyone has a great rest of their evening, and I will be in touch with you all soon.